This is very important question, right? Hypoglycemia is one of the complications of the diabetes which inhibits the physician, and is also the patients are also skeptical that my sugar will go very low, and that complication may bring the patient to the emergency and may also risk the life. So the linkage of the hypoglycemia and diabetes is because of the agent which person is using. If person is on insulin, obviously there will always be a risk of the hypoglycemia, although there have been significant improvement in the type of the insulin over the year. Now we are celebrating 100 years of the insulin discovery. So this newer insulin have slightly lesser risk of the hypoglycemia, but it's not entirely avoid of the hypoglycemia. So people who are on insulin should be aware that their glucose level may fall, and they have to match their lifestyle diet in a way to avoid the hypoglycemia. The second group of the people who are on sulfonylurea at oral medication used in type 2 diabetes, which causes release of the insulin from the pancreas, may also cause hypoglycemia. So if you are taking this group of medication, you have to discuss with your doctor, am I at risk of hypoglycemia and what I have to do to avoid the hypoglycemia. Beyond that, there are certain group of the people who are increased risk of the hypoglycemia, like if there is underlying kidney disease, underlying liver disease, uncontrolled hypothyroidism, or if there are some endocrine disorder or hormone related disorder. So, and some medication may potentiate the risk of the hypoglycemia. How to avoid the hypoglycemia? This is equally important. The first thing is you should know that are you on the medication which can cause hypoglycemia? Certainly if you are on insulin, and if you are on oral medication which can cause hypoglycemia, you have to discuss with your doctor what will be the premonitory symptoms of the hypoglycemia, how I will treat the hypoglycemia on my own. So there is a rule of 15. The rule of 15 is simple. Whenever your glucose is low means ideally less than 70, and then clinical hypoglycemia is the glucose level is below 54. So if the glucose is going low, you have to take 15 gram of the glucose and check your sugar 15 minutes after, and if your glucose is still low, you repeat the same amount of the glucose. So this simple rule of 15 you should remember. This glucose can easily be the normal glucose or any glucose, or you can, if it's not available, you can have sugar, you can have honey, you can have gur or anything whatever available at that point of the time. Sometimes you may not get the ideal glucose at that point of the time. If a person is unconscious, not responding, never push glucose through the mouth. Take him to the nearest hospital to get insulin glucose infusion done, and hold the insulin and other treatment for a while. Don't give those treatment at that point of the time.